for Health presents To Your Good Health Radio. Here are Melanie Cole, MS, and Dr. David Friedman.
Our next guest is an acclaimed surgeon in the area of aesthetic, plastic, and reconstructive surgery. He's a best-selling author and co-host of the award-winning talk show The Doctors, now in its 8th season. Welcome back to the show, Dr. Andrew Ordon. Here's Dr. David Friedman.
Doc, welcome back.
Hello, David. How are you? It's always a pleasure to be on with you.
Great to have you here. You know, there's been so many natural remedies that you featured on The Doctors. I've seen you cover bee sting therapy to combat multiple sclerosis, fibromyalgia, arthritis, to using wasabi to remedy allergies. Out of all these hundreds of tips you've shared, what's the most seemingly crazy but effective remedy?
Wow, you're coming right out of the blocks here, putting me on the spot here. You know, I guess, I'm going to defer to, my area of expertise on the skin that, I do like vinegar soaks on the face for flare-ups. It's a natural anti-inflammatory. It also is slightly acidic, is going to, bacteriostatic. So it'll help with flare-ups of your skin. I'm talking about acne type problems. That actually does work.
Any particular vinegar, like apple cider, or just
apple cider vinegar? There you go.
That's the best. That's great. That's good information. I wouldn't even think to use that on my face. So that's a great tip.
You'll smell a little bit like a Greek salad, but that's okay.
Or Easter egg. That's great. One of the major places I've noticed that when women start to show signs, even men, is the neck. And I've seen a lot of female patients take such great care of their face, but their neck looks 10 years older. With all this stuff available, shouldn't they be putting some more on their neck as well?
Exactly, David. Such a great point. And, as a plastic surgeon now, in practice 30 years, faces and necks are what I do most of surgically, and so many women and men for that matter, they just come in holding on to their neck, and this is what bothers me, this is what I don't like. And I think you addressed it, that people take care of the skin on their face. They wash their face, they apply creams, they put their SPF on, and they neglect their neck.
Yeah.
And the neck starts aging. Something unique about the neck, very thin skin. So that thin skin, just like around our eyelids, it gets crepey easier. It forms those fine lines because it's just thinner type skin. So that's another issue. That's another reason why you should get involved in taking care of your neck skin. Just like you take care of your facial skin, you should be taking care of your hands as well in a similar way. I think hands are also sort of a neglected area.
I remember seeing an interview where you shared how when you do a facelift, it's just that you lift the face upwards against gravity. That made so much sense compared to the popular method of pulling the skin sideways. Why hasn't common sense prevailed in many of your industry?
I love that question. I love that you picked up on that nuance. As I told you, as a facelift guru, it's all about the direction of pull, and it has to be vertical. I mean, gravity is pulling things down. In a facelift, neck lift, why would you want to pull things back into the side? It's counterintuitive, and that's where people start looking, windswept look, unnatural, pulled, pleats, all of those things. And, it's interesting, when you have the skin freed up in a facelift and you pull it, you can remove more skin around the ears if you pull it back. And that's the problem, that a doctor will go, I can get more skin if I pull it this direction. And that's where you get into trouble. You have to maintain that vertical vector of pull, removing in the direction where things have fallen. you do that, and you will get natural results in the face and neck.
Makes so much sense. It's common sense. Interesting. I want to share this about with people who may not know about you, but you've traveled abroad to perform charitable procedures to help underprivileged people. I'm curious, do these third world countries have sterile environments for you to perform surgery?
Great question, and probably one of the best things, having been on the Doctors Now our 8th season, is it has opened doors, has afforded me the opportunity to go abroad and to help people in need, so-called charity missions. And the first that we did was we went to Haiti, and after the earthquake, so many things were damaged, just were not there. Infrastructure, supplies, everything. There, yes, I was a little taken back under the conditions that we had to work. But then I subsequently went back and I worked. I still have a relationship with a hospital in Port-au-Prince, L'Hôpital d'Espoir, and I have to be quite honest with you that the facility is quite good. So,
really?
Once that tragic event sort of the dust settled, they got things back together again, and I was pretty impressed with how they worked. When I was in India with Smile Train, I was very impressed with how well they do. Although it may not have all the bells and whistles of a hospital here, they still maintain sterile technique. I was super impressed with the work that the surgeons were doing. I mean, just by sheer numbers, the doctor that I work with there, I think he legitimately can say that he's done more cleft lips than anyone in the world, and I think that's true. And
that's great. Well, it
was a wonderful experience for me seeing that, just sharing in his expertise.
That's awesome. One topic I want to cover before we let you go, which I wish you could stay. We can go on for hours, but I want to find out the role stress plays in our appearance. I know I hear about sunshine and wrong eating, but I look at these presidents, in 4 years, they look like they've aged 10 years after being in office. I would imagine stress is public enemy number one.
That's very, very timely. We have our elections coming up. We see all these candidates out there. Do they know what they're getting themselves into? They're going to have gray hair and wrinkles in 4 years or less if elected. And I mean, you can't deny it. The effect of stress with aging, that cortisol effect just wears you down. It speeds up the process of aging, and it all has to do with the inflammation caused by, free radicals and oxidation, so-called rusting of our body. And cortisol, will work against antioxidants. So what you need to do is learn to deal with your stress, find an outlet for your stress, and do all of those things in terms of eating right and exercise, and don't do the added things that will age you quicker. I guess if you're president, you have to work extra hard on that.
Yeah,
That's
great information.
It is great. You are a rockin' guest, Dr. Ordon. Thank you so much for being with us. For more information on the doctors, you can go to thedoctorstv.com. You can follow Dr. Ordon on Twitter at Dr. Andrew Ordon. And for our daily health tweets, you can follow us at Dr. David Friedman. Podcasts of all these shows are available. If you miss any of the great information that we're giving out, you can listen anytime, on demand, or on the go to yourgoodhealthradio.com. This is Melanie Cole. Thanks so much for listening with Dr. David Friedman. Stay well.